All right, today we're pulling back the curtain on one of the most intense, high stakes moments in all of medicine. We're talking about that moment when a surgeon, right in the middle of an operation, realizes they need help and makes a call that could literally save a patient's life. So let's scrub in. Every single surgery starts with a really clear plan. But the human body, well, it's just full of surprises, isn't it? Unexpected anatomy, some hidden complication, or even an accidental injury can turn a totally standard procedure into a full-blown crisis in a heartbeat. So, what happens then?
Well, that's when the call is made. It's this moment of just incredible focus, a deliberate pause right in the middle of all the chaos. The main surgeon has to recognize the limits of their own expertise in that split second and call a colleague for what's called an intraoperative consultation.
And you've got to understand, this isn't just some friendly chat. The source material we're looking at actually describes it as an invaluable lifeline. It's a really formal process, and it carries its own unique weight, its own pressure, and a whole set of rules. So, what is it exactly? Well, think of it as an urgent summons, a call for an expert opinion right in the middle of an operation. This could be for something called an iatrogenic injury, which is a fancy way of saying an injury that was accidentally caused by the medical treatment itself. Or it could be for some totally unexpected discovery that the primary surgeon just isn't equipped to handle on their own.
Okay, so let's flip this around for a second. What's it like to be on the other end of that call? I want you to imagine you're the consultant. You have to drop absolutely everything you're doing and walk into an operating room where you know no one, and you especially don't know the patient on the table.
I mean, the pressure on this consultant is just immense. They're walking into what's described as a likely strained atmosphere, right? They have zero prior knowledge of the patient. They don't know their values, their history, nothing. They have to rely solely on what the primary surgeon is telling them, all while the patient is unconscious and at their absolute most vulnerable.
And this really highlights a super important dynamic here. You see, it's so easy to look at this and think of it as a moment of failure, right? But the source material completely reframes it. The decision to call for help isn't a sign of weakness at all. It's a courageous act that puts the patient's well-being above everything else. It's all about teamwork, not ego.
Which, of course, brings us right to the heart of the drama. How do you make a potentially life-altering decision for someone who can't speak for themselves? I mean, this is the crucial ethical question, right? The patient is unconscious. They can't consent to a new, unplanned procedure. So all of that responsibility, it falls squarely on the shoulders of the medical team. So who gets to make that final call? Well, the truth is, it's not a solo decision. The consulting surgeon basically becomes the hub of this big communication network. They're gathering information from the primary surgeon, from the anesthesiologist, and, whenever possible, from the patient's family or surrogate. The whole goal is to build a consensus on the absolute best course of action. So broadly speaking, the team is staring down two main paths. The first is to temporize. That just means they do a quick, low-risk, and totally reversible fix to get the patient stable. This lets the patient wake up later and be part of the decision for a more complex repair. The other option? They can take definitive action right then and there, perform that complex repair immediately. It's definitely riskier, but it avoids needing a whole second surgery. So, what's the guiding principle in all of this? Well, whenever possible, the team is always going to choose the path that preserves the patient's autonomy. That means those big, complex, irreversible procedures, they're almost always delayed until the patient is awake and can be a real partner in their own healthcare decision. Okay, so once that really tough ethical choice is finally made, the entire focus of the room just pivots. It's no longer a question of what to do, but how to do it. And this is where the consultant's specialized craft really takes center stage, usually under just unimaginable pressure. So let's ground this in a really common scenario, okay? The source material points out that the bladder is actually the most commonly injured organ during pelvic surgery. So this is a classic reason for a urologist to get that urgent call to come into the OR. And you can see just how often this can happen. Now, I know percentages like 0.75% might seem really small, but when you think about the millions of these surgeries that are performed every year, it means this exact scenario plays out in operating rooms thousands and thousands of times. And the repair itself, wow, it's such a delicate art. To fix a ureter, for example, that's one of the tubes carrying urine from your kidneys, the surgeon has to meticulously remove any damaged tissue, stitch the ends together perfectly without any tension, and make absolutely sure the closure is watertight. Then they'll usually place a stent and a drain to help it all heal. It is a true masterclass in precision.
But here's the thing. The consultant's job isn't over when that last stitch is placed. Not by a long shot. What happens after the patient leaves the operating room is just as critical.
Documentation is absolutely paramount. The consultant's note has to be strictly factual. No guesswork, no opinions, and absolutely no blame. Words like careless are completely forbidden. And here's a key point. They have to write their own note. They can't just rely on the primary surgeon's summary. This is what creates a clear, objective record that ends up protecting both the patient and the entire medical team.
And then, of course, there's the conversation with the patient and their family. You have to remember, this consulting surgeon has just been thrown into a brand new, very sudden doctor-patient relationship. Being completely transparent about exactly what happened is essential for building trust and setting realistic expectations for the recovery that's ahead.
And this really gets to the professional ethos at the very heart of this moment. Despite all the incredible stress, despite the ridiculously high stakes, being the person that your colleague trusts enough to call in a crisis, well, that's described as nothing less than a profound honor. So it leaves us with this really powerful thought, doesn't it? The surgical lifeline. It isn't just about scalpels and sutures. It's really built on a foundation of humility, of courage, and of the profound trust that allows one expert to ask for help and another one to answer that call.